Binkie, Wookie, Dummy, Doki, Dodi, Soother. The pacifiers have so many names, so many shapes, sizes, materials, and types to choose from, and so many confusions surrounding their usage. But don't be confused. Here is a complete parenting MD primer on the pros and cons of pacifier use for your baby, and also some smart tips on how to choose the best baby pacifier and use it safely. So, let's start from the basic query. Is pacifier good or bad for baby? The expert bodies like American Academy of Pediatrics accept that pacifier use may help the babies if done correctly. In preterm babies, pacifier use has been shown to reduce hospital stay and ease the introduction of bottle feeding. Even in term babies, a pacifier may soothe in crying due to pain, in colic, or after minor medical procedures such as vaccination or circumcision. It can also soothe them to sleep and even cuts down risk of crib death or sudden infant death syndrome. It offers a slightly easier to stop replacement for finger sucking. There are some associated health problems too. Even though pacifier use does not lead to long-term eating behavior problems, early pacifier introduction may interfere with breastfeeding by causing nipple confusion for baby. Prolonged pacifier use is associated with increased risk of middle ear infections and dental malocclusion problems such as overbite or buck teeth. So, when can we offer pacifiers to the baby, and when should we stop it? If you plan to breastfeed, then ideally wait for the baby to turn 1 month old. First, establish the breastfeeding routine, and only then offer the pacifier. Do not offer it at feeding times, only offer at the nap times. As with any habit, the pacifier habit may become tougher to break if it goes on for a long time. To reduce the risk of ear infections and dental problems, it is better to stop pacifier use by baby's first birthday. With so many confusing choices, how do we choose the best baby pacifier and use it safely? Check out these things: an age-appropriate size, a sturdy single-piece construction without moving parts, built-in gadgets, or pre-filled liquid, a sealed rather than open base, at least 1.5 inches shield width to prevent choking risk, holes in the shield to allow airflow and prevent accumulation of saliva. Compared to the conventional round nipple pacifier, the orthodontic flat square nipple type is less likely to cause dental malalignment, as it allows baby's natural tongue thrust during sucking. When it comes to material, silicone pacifiers are more durable, easier to sterilize, and attract less germs compared to the latex, rubber, or soft plastic ones. A few safety tips. Don't ever tie the pacifier to baby's neck, hand, or crib. This is to avoid suffocation. Don't dip the nipple in sweet sugary syrup, juice, or honey. This is to avoid tooth decay. Sterilize it in boiling water and clean with warm soapy water or in dishwasher. Replace it when any cracks or breaks are observed. Choose a brand with a good safety profile. Do not try to use makeshift pacifiers made from household items or old used feeding accessories. One final word: despite all your attempts, your baby may sometimes refuse to accept pacifier and may use own fingers to self-soothe. It is perfectly fine. It is just nature at work. Pacifiers may be useful, but they are not essential.